Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then subdural hematoma. Right. Subdural hematoma. This subdural hematoma mainly it develops. What is the cause of subdural hematoma? It occurs mainly due to the rupture of the superior cerebral veins. When the superior cerebral veins will rupture, it results in subdural hematoma. So, what are the superior cerebral veins? These are nothing but rupture of the bridging veins. These bridging veins will actually connect the cerebral cortex to the sagittal sinus, that is to the superior sagittal sinus, and these are called as bridging veins. And these bridging veins, if they become ruptured, this will result in subdural hematoma. So here you will have a superior sagittal sinus, okay, and this is the brain. So the veins which connect the superior sagittal sinus to the cerebral cortex is called as bridging veins. Then, what is the etiology? Why is this subdural hematoma occurs? Etiology of subdural hematoma is it can be due to a head trauma, which is usually trivial and it might undergo unnoticed in almost 25% of cases. Okay, this is also very commonly seen in alcoholic patients. Here, the patient, it is also seen in patients with bleeding problems. Like the bleeding problems include whenever the patient is on anticoagulation, then there is increased chances of bleeding. Then if the patient has less platelets like thrombocytopenia, then clot formation will be defective, so leading to subdural hematoma. Or if the patient has liver failure, this will also liver is the one which produces clotting factors. In liver failure, there are less clotting factors are produced, resulting in subdural hematoma. Alcoholism, whenever there is alcoholism, this also causes subdural hematoma. Then we have dural lesions. Dural lesions can also cause subdural hematoma. Like in dural lesions, sarcomas, AV malformations, or metastatic cancer can also result in dural lesions or subdural hematoma. Or low CSF volume. Low CSF volume can also lead to subdural hematoma, like CSF shunts or renal dialysis or excess diuretics. All these can result in subdural hematoma.
thank you and thank you for watching.